So after injecting the tumescent solution, we would wait for about 5 to 10 minutes. In the meantime, what I'm going to be explaining you now, what are the armamentarium which are required to harvest fat. So now what we have done is we have devised a small set of kit which is actually going to kind of make the entire sequence of macrofat, microfat and the nanofat. So what do we require? So basically, if you want to harvest from the flanks, abdomen or the medial thigh, we normally require two cannulas. So one is basically an injection cannula which is going to inject the tumescent solution. If you see this, there are small openings here. Now this is basically a 2 mm by 16 cm tumescent injection cannula. The other cannula is basically again a 2 mm by 16 cm cannula, but this is a harvesting cannula. So what we are going to be doing here is basically putting a lure lock syringe behind it. So this goes and locks it here, and then to create a negative pressure we are going to be putting a stopper here. So this is basically a stopper here which would set in and create the negative pressure, which I am going to be showing it on the patient. So this creates a negative pressure. So this is what we would require for harvesting. So 16 cm by 2 mm cannula for harvesting from the abdomen, flanks and the medial thigh. Now what we have also done is basically we have created another set of cannulas for taking out the fat from the submental area. So like for example, patient wants to take care of his or her submental fat and we want to do submental liposuction. So we have this 2 mm by 10 cm cannula, again 2 mm by 10 cm tumescent injection cannula to push the tumescent into the submental area, and then 2 mm by 10 cm liposuction cannula which is going to harvest the fat, and this is going to take care of the superficial to platysma fat either in the submental area, or if you want to create a nice jawline, so this is going to help us in that. Remember that the deeper fat which is below the platysma, if there is a submental fat which is sitting below the submental area, so the deeper fat needs to be excised physically, and this is not going to take care of the deeper fat. This only takes care of the superficial to platysma fat. Okay, so once we have harvested that, so what we have here is basically a set of 4 transfers. So basically what this will do is, so these transfers are going to make the macro fat into macro and nano fat. So this is basically a 2.5 mm transfer. This is a 2 mm transfer. 2 mm transfer, this is a 1.5 and this is a 1 mm transfer. So what these will do is basically convert the macro into micro if I'm passing it through 2.5 to, and then from macro into micro when we pass it into 1.5, and if I want to break down into the nano fat which actually does not contain any fat volume and it is basically only the stromal vascular fraction or the stem cells, we pass multiple number of times through this 1 mm cannula, and it actually would kind of break down into the stem cells or the stromal vascular fraction. So macrofat is to give volume, microfat can be used into the lips and the teardrop area, and the nanofat would be for kind of rejuvenation all over the face or into the scalp for the hair regrowth. So this is entire armamentarium which is actually required now to kind of harvest and make the fat macro, micro or nano. So this is how we go ahead, and now I'll show you how we harvest the fat.